Hello everyone, welcome back to Nurse Growth Hub. In today's lecture, we are going to discuss public speaking, an important soft skill for B.Sc nursing students. Now, we hear the term public speaking, we often imagine someone standing on the stage and giving a speech. But in nursing, public speaking happens in many everyday situations. You may have to present a case, or conduct a seminar, educate a patient, speak to a community group, present research, or participate in a professional meeting. So, public speaking is not just about speaking in front of a large group. It is about communicating your knowledge and ideas clearly and confidently to a group of people. Let's understand how we can develop this skill. By the end of this session, you will understand the elements and types of public speaking, how to begin a speech effectively, how to make your speech more engaging, and the factors that can influence your speaking. Most importantly, we'll connect these concepts with the practical nursing situations. What is public speaking? Public speaking is a process of communicating information, ideas, and opinions verbally to a group of people. For example, imagine a community health nurse conducting a health education regarding hypertension. The nurse is the speaker, the information about hypertension is the message, and the community members are the audience. This is public speaking, and it's an important nursing skill because nurses are not only caregivers, we are also educators, communicators, advocates, and leaders. Now let's see elements. Effective public speaking involves 7 basic elements: speaker, message, audience, channel, feedback, context, and noise. The speaker delivers the message. The message is the information about being communicated. The audience receives it. The channel is how the message is delivered, for example, face to face or through an online presentation like I'm doing now. Feedback is the audience response, such as questions and their reactions. And context is the situation in which you are speaking. And the noise means anything that interferes the communication, like background noise, technical problems, distractions, language barriers. So, effective public speaking isn't simply about talking, it is about making sure that your message reaches and is understood by your audience. So, let's look at major types of public speaking. First, informative speaking. The purpose is to provide knowledge. And the second is persuasive speaking. The purpose is to influence someone's attitude or behavior. And the third is demonstrative speaking. The speaker shows the audience how to do something. For example, demonstrating a hand hygiene. We also have entertaining speaking, such as speaking during a college program, and special occasion speaking, such as a welcome address, farewell speech, and vote of thanks. So, the type of speech depends on your purpose and your audience. Now it's about beginning a speech. Now comes one of the most common challenges for students. How do I start my presentation? A good opening should immediately create an attention and interest. Instead of simply saying, "Good morning, today I'm going to present," or continuing for several minutes, try beginning with something that makes the audience think. You can start with a question, a fact, a short story, a powerful statement, or a relevant quote. For example, if the topic is hand hygiene, you could ask, how many of you think that hand hygiene is important only inside the hospital? That question immediately involves the audience, and then you introduce yourself and the topic and briefly tell them that what they are going to learn. So remember, grab attention and introduce yourself, introduce the topic, state the purpose. Effective speech. Now, how do we make a speech effective? A good speech should be clear, concise, correct, organized, relevant, and interesting. And there's one principle I want you to remember. Don't try to impress your audience with difficult words. Try to make your message easy to understand. This is particularly important for nurses. When you are talking to patients or the community, too much medical terminology can create a confusion. Structure. A good speech should have a simple structure: introduction, body, and the conclusion. In the introduction, tell the audience what you're going to discuss. In the body, explain the main points using examples, and in conclusion, summarize what you want them to remember. Think of it like a nursing procedure. You follow a logical sequences rather than randomly performing a steps. The same principle applies to your presentation as well. Organized content is easier to understand and easier to remember. Knowing your content is important, but how you deliver it is equally important. Pay attention to your volume, speed, pronunciation, tone, pauses, and emphasizes. One common problem among nervous students is speaking too quickly. So, slow down, use pauses after important points, and allow your voice to vary instead of speaking in exactly the same tone throughout the presentation. Your body language also communicates. Maintain appropriate eye contact, stand confidently, use natural gesture, keep your facial expression appropriate, and avoid constantly looking at the floor or reading directly from the slides. Remember this: your audience should feel that you are speaking to them, not simply reading to them. So, this is the body language that you need to follow, and this is the body language that you need to avoid. A good speaker doesn't simply talk to the audience, they interact with them, ask questions, use simple examples, tell a story, short story, encourage participation. Like, for example, during a dengue presentation, like you could ask them, can anyone tell me 2 ways that we can prevent dengue? Now the audience is thinking and participating. And visual aids can also help. You can use PowerPoint slides, pictures, charts, videos, and demonstration materials. But remember, your slides should support your speech, not replace you. Avoid putting long paragraphs on the slides, and that confidence in public speaking comes largely from preparation. Before your presentation, know your topic, understand the audience, organize the content, prepare your AVH, and practice a lot. One simple technique I highly recommend is to record yourself before a mirror, important presentations, and watch the recording and ask yourself, am I speaking too fast? Am I having eye contact? And am I reading the slides? Are these gestures natural? These simple practices can make a big difference. Several factors can influence public speaking. First is the speaker, their knowledge, confidence, preparation, and anxiety. Second is the audience, their age, knowledge, interest, expectations, and size. Third is the environment, noise, lighting, seating arrangement, and distractions. And fourth is technology, like microphones, projectors, internet connections, and other technical issues. A good speaker should therefore prepare not only the speech but also be ready for unexpected situations. Public speaking anxiety. Now let's talk about something many students experience. You may have a fast heartbeat, sweaty palms, trembling, forget your words, and suddenly start speaking very quickly. These feelings are normal. You don't have to completely eliminate nervousness. You need to learn how to manage it. Remember these simple sequences: prepare, practice, breathe, pause, and speak. And don't aim for perfection, aim for clear and meaningful communication. Clinical example, nursing application. Let's apply everything we have learned to a nursing situation. Imagine that you're a community health nurse educating the mothers about prevention of home accidents among the young children. And you could begin by asking how many of you have a small child at home who loves to explore everything around them? Then explain the topic using simple language. Give a practical example such as like keeping medicines and cleaning products out of the children's reach. Demonstrate safety measures where appropriate. Ask questions, encourage participation, and finally summarize the key points. This one session can involve informative, persuasive, and demonstrative public speaking. That's why this skill is so relevant to nursing practices. Let's quickly revise. The elements of public speaking are speaker, message, audience, channel, feedback, context, and noise. The major types are informative, persuasive, or demonstration, entertaining, and speech or special occasion. To begin, effective, grab attention, introduce yourself, introduce the topic, state the purpose. An effective speech should be clear, concise, organized, relevant, and engaging. Finally, remember the major factors: speaker audience, environment, technology, and message. Final takeaway. So, what you should take away from today's lecture: public speaking is not about being perfect or having a naturally confident personality. It is a skill, and like any other skill, it improves with knowledge, present preparation, practices, and experience. As nurses, we need the skill to educate patients, conduct a health program, present cases, teach others, communicate research, and eventually take a leadership responsibility. So don't look at public speaking as just another classroom requirement. Look at it as a skill that can strengthen your entire nursing career. Speak clearly, speak confidently, and speak with purpose. Thank you for watching Nurse Growth Hub. If you found this lecture useful, don't forget to like, share, and subscribe. Keep learning, keep practicing, and keep growing into nurse that you want to become. I'll see you in the next lecture. Happy learning!